This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And I have another video on a person who had a dropped arch, and he had a lack of movement of the calcaneus, which I restored, and then that restored his arch. However, Jackson is a different case. He presents with less arch on the right foot, and if I slide in with a fair amount of force, you can see that the deepest part of his arch is halfway over here. Okay? And then if we do his left side, we go deep. We go past this mark. Okay? So, I would arbitrarily say it's a ½ inch. I'm going to say fallen, but that's the wrong term, and I'll tell you why. I'm going to suggest to you that in this example, that's the way he developed. And because his body developed that way, all the ligaments developed normal length. The joints developed a norm of movement that's not pathological. I screened every major joint in that foot and ankle, and I found, excellent mobility, excellent end range stress. In standing, you rotate beautifully in the, throughout the tibia on downward. You rotate beautifully that way. When I evert you in weight bearing, it's very similar to this ankle. When I invert you in weight bearing, it's very similar to this ankle. It's not painful. Let's have you lie on your back with your feet down at this end. Mm-hmm. And you were given some arch supports, am I correct?
Yes.
Okay, but you don't use them very often?
Correct.
Okay, and why is that?
They were a little uncomfortable.
Okay.
And, I hadn't been having much pain in my foot.
Exactly. Yeah, so I don't think you need them.
Yeah.
And your dorsiflexion is equal, okay? Your plantar flexion with overpressure is equal. Your inversion throughout the whole foot is equal, as is eversion. And now I specifically test the calcaneus, keeping, I could block the ankle joint, but I'm letting the ankle joint participate, and equal inversion relative to the other side. Okay, very, very similar. And at the end of movement, so I'm rotating the foot outward through the calcaneus, including the talus, and allowing the talus to rotate also. Okay, and then I overpressure it, and it has good spring mobility. The midfoot has good pronation mobility and good spring at the end of that, and then testing supination in the midfoot and overpressuring it. It's normal. So this is the way you're made at the factory. It's a factory setting that serves you well, and for that reason, I don't think you need an arch support on that side. I understand a lot of clinicians would say that you need it, but we have a very strong ankle. There's no laxity in your ankle when I do a drawer test or when I do an inversion stress test. Your strength is fabulous.
Yeah. Okay?
So I think this is just a very interesting example of someone who simply has two different arches, but they serve him very well. And it's pretty unique. I so rarely see this, so thanks for letting me film it.
Sure.